Hi, I'm Dr. Mark Pederson. I'm a chiropractor and clinical nutritionist, and I want to thank you for taking the time to watch this video on our sensitivity and allergy testing. Now, you just watched the video on the Bax 3000, and this machine is the Nano SRT. As with any technology, there's always upgrades and improvements, and this is the latest version of the Bax 3000. I want to walk through with you just for a few minutes here, kind of the nuts and bolts of how is the testing done, the step-by-step. So with the testing, on the digitized testing, we're actually sending out a digital signal that mimics the allergen or sensitivity item that we want to test. So let's say it's a pollen, maybe a grass pollen or a tree pollen, could be a cat dander, could be some environmental chemical that we want to see how does your body respond to that. Are you having a sensitive response to that? So again, the step-by-step. When we do the testing, we take the external antenna, we call it the focus, and we clip that to usually your collar. And what this is doing is sending out the digital signal that mimics the item that we want to test for. We put that on the shirt collar. Step two is we take the electrodes and we place them on the measuring points on your hands. So we would connect the electrodes. And then we would clip those to the machine with the testing clips. And now we're ready to test. When the testing starts, we're going to test through a number of items. What items? It really depends what group and your clinical history. It might be through foods, it might be through pollens, again it could be chemicals, environmental chemicals. And the amount of things that we're testing for will determine the amount of time it takes to run the test. Average time's around 7 to maybe 11 minutes. So you'll sit there as the machine does the testing, and when the testing is completed, we're going to get a printout. So again, step by step, the digital signal is being output that mimics the item we're testing, and we're measuring your body's response to that item. Once we have that test complete, we'll have a printout, and you have one of these in your informational packets. It tells what item is tested and what your outcome was. Now there's a normal range, as with any lab test, and then there's abnormal ranges. A normal range is a -20 to a +20. Above that, above 20 is an indicator that you're having a reaction to it, and the farther above 20, the more severe the reaction. On the other side is the -20, and if we go down that scale, you're having a reaction, but it's more on a chronic basis. It's a chronic reaction. So again, we'll do the testing. Through the testing electrodes, we'll measure your body's response, and then we'll be able to graph it out and see what do we need to work on. I like to make a little analogy with traditional medical allergy testing here. Now on traditional allergy testing, typically it's a scratch test or a pinprick test, and they might have an item of 4 or 5 needles, and they would scratch across your skin and poke it. And on the tips of those needles would be the allergen that we're going to test for. They might do it on the arm, more commonly on the back. And some patients, they've come in and they've said, well, you know, I had 5 or 6 items tested. Some patients have come in and said, I've had 200 or 300 items tested. And what they're doing is introducing that allergen to your body and measuring or observing the response. Do you welt up? Does it turn red? Very similar thing that we're doing with the Nano SRT is that it's a FDA cleared device for biofeedback testing for sensitivities. So we're outputting the digital signal, we're introducing that into the body, and we're measuring through the clips, we're measuring your body's response. Instead of observing for a welt up or a swelling or a redness, we're going to graph it out and see, are you reacting to it, and how severe, acutely, or chronic is that reaction? Now once we have the information, we're going to do the desensitizing treatment. The way that works is we will pull up or program back in those items that we need to desensitize. Basically those ones that you're reacting to the worst. And then we're going to put it along with your clinical history and determine what do we want to treat for. When we do the sensitivity desensitizing, we again output through the antenna the signals that were most out of range for your test. And then while we're outputting those, we're going to take this laser and do a balancing frequency to balance that response in your body. And with the laser, we're going to stimulate acupressure points on your hand, your arm, and down your spine. And again, let's make an analogy here with traditional allergy treatments, such as allergy drops. With an allergy drop, what we're doing is we're taking a small amount of the allergen, putting it into the body repeatedly to try to normalize your body's response to that specific allergen. Very similar concept. We're taking the frequencies for the allergens or sensitivities that you're most reactive to. We're outputting those, so we're stimulating the body with those, and at the same time we're using a balancing frequency with the laser to stimulate acupressure points on the hand, arm, and down the spine to normalize that response. So let's take a scenario. Let's say a person has a cat allergy and they walk into a room with cats and their friend comes in with them, but their friend does not have a reaction to cats. Person A will welt up, their eyes will swell, they might start to tear up, they might just sneeze, and they might start to cough or clear their throat. Well, person B has no reaction at all. Well, person A, their nervous system and their immune system is having an overreaction to that item, in this case cats. And we would try to bring down or normalize their bodies, their nervous system, their immune system's response to that item. And it could be a cat, it could be a food, could be an environmental chemical, pollens, grass pollens, flower pollen, tree pollens. Depends on, again, what your scan shows up. In your informational packet, there's also a outline of an interview I did with Innovative Healthcare. So there's more information on the testing and treatment in there. And there's also a tab on our website, which is optimalhealth.co, and it's spelled out optimal-health, HEALTH.co, so .co. And if you go there, you can find more information under the Allergies and Sensitivities tab. Again, I'm Dr. Mark Pederson. I appreciate you watching this video. If you have any questions, please feel free to contact our office. Our office number is 218-745-6655. Thank you.